Welcome to the ECAPS Watch podcast. I'm Kevin Houlihan, CEO at Workflow Services, and today I'm excited to be joined by James Allen, Manager of Clinical Performance with AlignRX. James, you have a master's in public health, so you're coming to us with a kind of unique perspective, and I'm excited to chat. And I'm really excited to talk with you today about the expanding role of pharmacy teams in providing care that ECAPS can facilitate. So I'd love to hear your thoughts. I think pharmacy has been kind of a big part of your family, although you have more of a focus in public health. Can you share a little bit about how you've interacted with pharmacies?
Yes, absolutely. It's really the bringing together of two worlds in which I have lived, pharmacy and public health. I grew up in the world of pharmacy. My father was an independent pharmacy owner in rural Western Oklahoma. And I grew up, of course, working there as a teenager. And I can remember everything from delivering medications to patients. And often the times these patients did not have, transportation of their own. We were bringing the medications to them and just having that conversation with them, really getting to know them. And, my father was just, he loved everybody in that community, and he took really good care of them. And one memory that I have in particular that is really relevant to what we're talking about today, toward the back of his pharmacy, he began setting up a couple of desks, a couple of consultation areas with a computer and notes and binders. And he was intending that to be a counseling center, a station for him to talk about patients' medications, talking, any questions, almost like MTM before MTM was a thing. And he was going to have all this great documentation. And he was really excited about this. That was the part of pharmacy that he really enjoyed. Well, as time went on, those spaces began to accumulate other binders and books and a microfiche machine. So I'm dating myself a little bit here. Everything but the patients. And I just kind of noticed that. Well, fast forward to more modern times, I'm asking him in his retirement, Dad, whatever happened to that patient counseling? I remember you were so excited about that, and I'm in pharmacy now, and we're seeing a lot of this happen. He said, well, my challenge was I had no way to connect the notes and the conversations and the counseling I was giving to my dispensing system and where all the action happened in the pharmacy. It didn't exist yet.
Yeah.
And what he was talking about may sound familiar to some people listening as basically an e-care plan, an electronic care plan or clinical documentation, which of course we have today.
Yeah.
But that was in particular a memory that really sticks out to me. I think he was very forward thinking, just ahead of the technology a little bit. But it's been exciting now to see that happening in pharmacy and seeing that total patient care beginning to occur.
Yeah, well, that's an interesting story, and it brings up a couple things. It sounds like your family was really progressive there, but also, it sounds a lot more like providing healthcare than it does dispensing pills and putting them in bottles. And so
that's right.
I think part of that is probably, I assume, the progressive just personality of your dad, but also you mentioned that it was a rural setting, and I think that is even kind of more important and more relevant in the rural setting, that the pharmacy can really play a unique role in how healthcare is delivered. And it sounds like you saw that a bunch.
Yes, absolutely. Pharmacy is that connection point. I often think of pharmacy as air traffic control within healthcare. All the various providers that are out there, we can see the prescriptions, the medications inbound. These different providers may or may not connect with each other, but the pharmacy can see to an extent what's happening there. And it's a great way for them to coordinate. And, of course, we talk about coordinating medication, drug therapy problems, and items such as this, but then also just that touch point for the patient. And you had mentioned the pills and the bottles, taking beyond not just the pills and the bottles, but this gives us the opportunity now to make sure that, are we getting the outcomes that are necessary? Are there some data points I can collect and share with the provider to help, be part of that decision support that they may need in caring for the patient, helping the patient understand the medications, how to take them properly, take 2 tablets twice daily. That something that sounds pretty simple can be pretty complicated for some. And so it really puts pharmacy in a position to do more with the medications in the bottles and with opportunities to now be reimbursed for that is very, very important.
And that, I mean, that's been proven out quite strongly over the course of the past couple decades, right? You have an interesting path in that you moved into public health rather than pharmacy, but you were sharing some stories about how those things have kind of diverged and intersected a few times. But we've certainly seen that the pharmacy can play a key role in better health outcomes through vaccinations. And you were talking about how those two worlds of public health and pharmacy cross for you.
So in my public health days, one of my roles was monitoring population health data. This was in the state of Oklahoma. And this was about 10, 15 years ago. And we were looking at immunization rates, a common metric in public health that we study. And we noticed that some of our immunization numbers, when we looked year over year, were beginning to drop. And was, of concern to us, of course. And then I made the connection. During this time, pharmacies were offering more and more, particularly flu vaccine at that time. And at the time, pharmacies were not widely connected to our state's immunization information system. It was not a requirement. And, this was kind of a new thing for pharmacies. It hadn't really taken off really until COVID. And that's when we saw a real uptake with that. And so what we discovered was, yes, the rates were going down based on what we were seeing from providers, from medical providers, because it was shifting more into the pharmacy world. And so that was an example of pharmacy really filling an important role. And that then ties into what my role had been with developing our state health improvement plan and really trying to help Oklahomans for my state really follow through and make the healthy choice the easy choice and the accessible choice. And when we're talking about access to healthcare and provider shortage areas, a lot of these terms we talk about in public health, pharmacy is, I think, the connection that we didn't have at that time or that we were not making at the time. I often joke, I wish I could get in my DeLorean, go 88 miles per hour, jump back about 10, 15 years, and we would have some solutions, I think, to some of the challenges we were seeing there. Now, today, yes, we are seeing that plug in. We are seeing pharmacies across the country plugging in more with public health and being a part of the public health discussion, chronic disease, immunizations, tests to treat, as with ECAPS. So it's been really exciting to see these worlds continuing to come together and merge together.
Yeah, I love that visual of being able to go back in time and understand the power that's there. It reminds me of another little saying. I don't know if you're familiar with this one, but do you know when the best time to plant a tree is?
What is that?
20 years ago. The second best time to plant a tree is today, right? And the idea is
right.
Even though we couldn't do it, let's make sure we don't wait another 20 years. And so that kind of makes me think about where we are with this legislation today, the ECAPS stuff, to link it back there. I think we've talked about how we've proven that vaccine delivery, especially in rural settings, can be really critical. Vaccines are a little bit interesting because it's certainly preventative, right? And so you want to kind of get it around the right time within maybe span of the right few weeks. But ECAPS is really focused on test to treat for respiratory. So talk a little bit. I find it frustrating that there are a whole bunch of people in the country that can go get test to treat services in pharmacy based on what insurance they have. But if they're covered by Medicare, they can't. And that seems kind of crazy and arbitrary, but also the missed opportunity. Let's not have to hope 20 years from now that we need to get into DeLorean and come back today and change the way things work. Let's make it happen now. What do you think about that sort of unfortunate barrier that's there today for Medicare and how ECAPS can play a role, but how maybe test to treat even is potentially more impactful in some of these rural communities in the pharmacy setting?
Right. And it's the intersection of individuals who are in a rural community and who are Medicare patients. So typically older patients who are at higher risk of complications from these very conditions, these respiratory conditions that we're talking about. And so the ability to bill for those services, for those test to treat services, that will really be a game changer in terms of protecting the health of that population. Because for many of them in those rural areas, that local pharmacy, that is their closest and most convenient touch point for healthcare, or for some, the only one they may be able to easily get to. individuals who don't have easy access to transportation, or for whom a local provider's office may not be open every day, or if it's a provider who often sees multiple communities over the course of a week, or may have limited hours or just capacity, given everything else that they're needing to take care of. Well, the pharmacy is here. They're open every day in these communities, and they are very accessible. To be able to provide these services and these test to treat services on the treatment side. So if we're talking, Tamiflu or Paxlovid, these are medications that need to be started quickly once I have a positive test. And so we need to remove any barrier, uh, physical barrier time-wise, that would interfere with a patient getting these medications as quickly as possible. So the ability to have an access point in my community, get these tests to treat services, get on the road to recovery, and then, as you mentioned, now on the really preventive side, getting the immunizations to then reduce my risk at the same time, just layering these protective factors for those patients. We're going to see I think, some real improvement in health outcomes, and of course, prevent some hospitalizations and very unfortunate outcomes at the same time. But pharmacists have got to be able to bill for those services so they can provide them, and that's where ECAPS is so important.
Yeah, and that's a thing that I think many folks who might not live in a rural community might be easy to forget or might not be readily apparent, that there are communities that have a clinic in them, but that clinic might not actually be open every day. It's only open a few days of the week, right? And so even if it's there, that doesn't mean it's always available. And you're not talking about taking high complexity work away from a physician, right? This is a very limited set of services.
Right. No, this is a very specific area. It's within a state scope of practice, so that that still governs, of course, what pharmacists can do in different states. And no, we're not getting into complex healthcare, chronic diseases. There is certainly a role for pharmacy to play in that, but it's nothing that's going to take away from what physicians, nurse practitioners, other providers are already doing. This is more just helping to strengthen that healthcare system, close some gaps, make sure that vulnerable patients are not falling through those gaps.
Yeah. I think there's a bunch of things in there that are pretty important. And one of the things that we're passionate about is by opening up more care settings and more access points, we're not introducing a chasm between the different areas that, the different places, the continuum of care that someone can get. And so we want to make sure that we can document what's happening in the pharmacy and this kind of care that's delivered so that the patient's primary care provider has access to it if they need it.
Absolutely. It's that two-way communication. And that way the provider can know that this patient came in for an immunization or had a positive COVID test. We got treatment for them. And that's good information for those providers to have.
And as you mentioned, the legislation as it's written right now, when we're talking today, still has kind of the state rules govern what's happening, right? So if the state has said it's okay for pharmacies to deliver this kind of care, this legislation then says, okay, then Medicare patients can get access to it in the pharmacy.
Right. Absolutely. It's still governed state by state. And so what pharmacies in one state are able to do may not match what pharmacies in another state are able to do, but at least we have removed that barrier of not being able to bill for the services if I am eligible per my state laws to provide them. And so that's what we want to do, is really open that up and allow that access. And then for patients, being able to use these services and recognize that pharmacies provide these, and that's where the pharmacies need to then be getting out and really communicating in their communities that hey, we can take care of you, we can provide these services for you.
Yeah, well, I've talked about it with other guests. It's frustrating for me that you can be in a community and some folks in the community can go to the pharmacy for these services, but today folks who have Medicare can't, just because of the arbitrary nature of who their insurance provider is.
Yes, absolutely. Yeah, it's determined on who my insurance is with. Absolutely.
Yeah.
You are correct.
And so I'm hopeful that if ECAPS passes, that also helps expand more scope in more states. And so that we see that there are Medicare patients in some states that are able to get services. Why not in all states? And I'm hopeful
Right.
that's a downstream impact here, but
Sure.
certainly great first step of, I think there's, close to 40 states that allow this kind of care to be delivered by pharmacies. Let's tackle those first and really make a huge difference here.
Right, absolutely. Let's use the tools that we have available to us, and then have success with those, and then have some more of those downstream discussions for sure.
Yeah. Well, I'm particularly excited about the momentum we're hearing around this legislation and the impact that it can have in recognizing the key role that a pharmacy can play in the community, particular rural communities. It's been great chatting with you here today. Any final
Yes.
thoughts you have about ECAPS or the role of pharmacy?
I think just yes, keep supporting ECAPS, and let's utilize that to the fullest extent. Once I'm very optimistic that it will pass. Pharmacies, get out there, engage your patients, let them know what's available to them, reach out to those vulnerable populations, and then let's really hit a home run with this and have some additional discussions down the road to help continue to fill in gaps and really be a significant touch point that you are with the patients and the managing of their chronic conditions, and really think outside the box on creative ways to engage those patients. I'll leave with an analogy. We talked about planting the tree. Well, let's look to the future also. We're going to launch a rocket to Mars, but we're not going to aim that rocket at Mars. We're going to aim that rocket at where Mars will be
Right.
when we get there in 2 years.
I love
So
that. Yeah.
reach out ahead, look at the momentum, anticipate where we're going to be or where we need to be.
Yeah, that's a great analogy. Well, James, it was great talking with you today. Thanks for taking the time and joining
Thank
me.
you very much.
Good
I appreciate the
conversation.
opportunity.
Yeah, and we'll look forward to having folks join us on our next episode of the ECAPS Watch podcast.
Sounds great. Thank you very much.